Hello everyone, we hope you're all staying safe in these challenging times. It's me Sumaya and my colleagues Haya, Nuran and Dalia representing Ajman and Khalifa universities, presenting to you our research and outcomes on structural heart diseases pathway. Before commencing, we would like to thank Siemens for this incredibly insightful program and Mr. Sultan Haider, Mr. Mehdi and Ms. Weber for their continuous guidance throughout the program. The process of our workflow followed a path of identifying healthcare trends, understanding the disease, interviewing UAE-based cardiologists and structural heart disease patients in order to gather quality information to put together in our care plan, where we introduced 36 pain points, 40 respective solutions inspired by AI, robotic surgeries, and many more, which extend to 17 different stakeholders. We then concluded with a summary of our outcomes. We've identified the trends you see here that affect healthcare in the UAE, which was a vital step before digging into our topic.
I was in so much pain, she said. It felt like the pressure of something heavy lying on my chest and pulling my muscles apart like someone kicked my chest. That's what 40-year-old Safat described what it felt like. Because you see, a heart attack is just about the last thing on most of our minds. We never really think it's going to be us, you know? But it does, and we live in a place where 2/3 of our country here in the UAE is at risk of heart disease, with 30% of the population obese and 80% overweight. Our topic we introduced to you today is structural heart disease, which is an irreversible defect of the heart structure. This can either be something you're born with, like kids who are born with holes in their heart, or something you develop because of genetics, diet, smoking, stress, or tension, for example. So let me ask you this. How tense are you right now? Are your face muscles relaxed? Are your eyebrows raised? Is your posture ideal? I wonder how many of you could answer yes to all three questions. On this slide, you may find the facts and figures we've collected regarding our disease to illustrate the urgency of this matter.
Moving on and briefly walking you through our care plan pain points and proposed solutions, we find that at the prenatal stage, limited fetal intervention surgeries and the intake of unhealthy diet in the UAE are areas which very much need attention and consideration, as well as hoped for robotic surgery and virtual nutritionist solutions. When we look at how COVID-19 comes into play at this stage, we find out that pregnant women's routine checkups and the resources available to their newborns were significantly affected. Next, for the prevention stage, we see that lack of exercise, stress, high blood pressure are all hot topics that could be met with smart insoles and vibration suits, for example, as solutions. Also, structural heart disease patients are at a much higher risk for COVID. In the symptom stage, we find patients forgetting to take their medicine, the inability to define and express or even recognize symptoms, to which we hope for many applications and portals to counteract. Moreover, structural heart disease patients find it very difficult to wear masks during this COVID era. In diagnosis, we see that there are delays usually to the insurance approvals and divergence to general practitioners. And of course, this pandemic takes a toll on delayed appointments. During treatment, it's interesting to see that 6% of cardiac surgery patients die a preventable death due to distractions and minimal screen visibility in the OR. Operators also experience high radiation, to which we hope could be met with ceiling suspended LED suits as an affordable and effective solution. Lastly, the follow-up on outpatient stages gave us insight on problems where patients are not compliant with their treatments, for example, or call centers that aren't through with patients. Therefore, we hope that telemedicine and AI call center bots help tackle this issue.
The first solution that we came up with after brainstorming our pain points is the digital fork. The fork basically works as a salt simulator without adding salt to the food, by providing a gentle electrical shock that allows the flow of electrons across the tongue, providing saltiness sensation with a controlled and small amount of current. This fork is based on Arduino Mini that works as a current generator, and the objective of this fork is to control the hypertension that the salt or the sodium can cause to the body.
CVD and SHD patients are elderly patients who often forget to take their medications. It's incredibly important, however, that they do so that their heart doesn't fail them. If patients aren't compliant, then treatment will ultimately fail. To solve this, we propose a smart medicine box that uses pressure sensors to sense the box's fullness and respective duration, and then it connects to an app that notifies the healthcare providers, the families, and designated pharmacies that something's out of place. This also helps to ensure patients don't play around with their doses with the exacerbation and relief of symptoms.
Preventable deaths usually happen in the operation room due to distractions and minimal screen visibility. Our solution to this pain point is an innovative cognitive aid solution that contains an interactive wheel screen that includes critical checklists, patient's information, and emergency manuals in case the surgeon loses focus, and this solution would help in improving the visibility, while the screen has an iris detection sensor so that the surgeon can zoom in and out with his iris.
Briefly brushing through what we brought to you today is our focused pain points and respective solutions that include hypertension, where we proposed the solution of a digital fork, patients not compliant with medication in the long run, which was met with a smart medicine box, and lastly, minimal focus and visibility in the operating room causing preventable deaths that was met with OR cognitive aids. Here you may observe the heart of our care plan process for each stage combined into one slide to give you an idea of the workflow we benefited from throughout our research, where we take you from the very beginning of a person's life at the prenatal stage and leave you at the outpatient stage, where the patient is answerable to their responsibilities of compliance. So, before you come to think that a heart attack is the last thing on your mind, please remember this process and ask yourself what risks you've exposed yourself to, and what solution route would you want to take. No matter who you are or which stage you're presented in the care plan, your heart is important. And just as you treat it with the utmost care, we hope you also receive the utmost care in each of the stages. Thank you all for listening, and if you have any questions, please don't hesitate.